Hello dear students, today we are going to learn about the concept of placebo and history of inert treatments from modern day placebos to be taken out of an understanding of health. So today our objectives would be, in this lesson we will discuss firstly about the concept of placebo and how history of inert treatments evolved over years, then followed by the role of placebo in the context of health. First, let's start with the definition of placebo. Serafino has offered a definition for placebo. According to him, an inert substance or procedure that produces an effect is called placebo. Here, if you see the term inert, it indicates that a chemical substance which is very inactive. So, placebos are treatments or rather techniques used instead of medical treatments that strangely produce very real and lasting sense of relief and have been known to work in almost all organ systems in the body and can be effective on wide varieties of diseases including chest pain, arthritis, headaches, ulcers, hypertension, cold, and also studies reveal that this placebo effect is very influential in reducing the pain. In many medical conditions whereby physicians are unable to find the specific cause for any physical condition, they often restore themselves to placebo treatment. In terms of administering sugar pills or vitamin tablets or any inert medication to a patient, often without their knowledge. In fact, the patients take the treatment believing that it is a pain reducing drug. Is it not quite interesting? Let's start trying to analyze what is more deeper in the concept of placebo. However, placebo effectiveness largely depends on the belief and behavior of the patient during the treatment, but can be ineffective if overused or more overworks better under clinical settings. This implies that a placebo that looks, tastes, and feels like real medicine is likely to enhance patients' confidence and thus its effectiveness. In addition, the behavior and attitude of the physician can also influence the effectiveness of placebo. Placebo may lead to physiological changes which in turn can decrease the pain experiences. Virtually every medical treatment shows some degree of placebo effect. Research suggests that the endorphin system is activated when people have belief that they are receiving a painkiller when they are actually receiving a placebo. The word placebo actually taken from a Latin word and it means actually I shall please. This word has been first used around 14th century. Early days of medicine, few drugs or treatments gave any real physical benefit. As a consequence, patients were treated with a variety of bizarre, largely ineffective therapies. For example, ancient days, one of the treatment used to be followed by the Egyptians. Egyptian patients were medicated with lizard blood, crocodile dung, and the teeth of swine and the fly specks. These treatments were not only ineffective but actually they are very dangerous. Later on in the Middle Age, the treatments were somewhat less lethal but not much effective. Europeans, for example, European patients were treated with powder of Egyptian mummy for healing wounds, and they used to use leeches for blood sucking because they used to believe that that will reduce their fever. Around the same time, around the 1700th century, there was a familiar story. It's about the powder of sympathy. So what people used to do is they used to apply powder to the weapons that caused the wound in order to achieve the healing. It seems that often the method was effective and the injured recovered. Such examples of medical practices in olden days make it seem miraculous that anyone survived these medical treatments, but people did moreover. They often seem to get relief from these peculiar and ineffective remedies. The most likely answer is that these treatments are examples of placebo effect. Placebo effects continue to be powerful even in today modern days. So let's see what is modern day placebo, how it starts emerged. The effects of placebos have more recently been studied, in which has one of the researcher in the field of health psychology listed their effectiveness in various areas such as allergies, asthma, cancer, diabetes, epilepsy, insomnia, obesity, acne, smoking and dementia. One of the most studied area in relation to placebo effect is pain, in which the works of Beecher are to be highlighted. He did quite interesting study. Let's see what it is about. Henry Beecher discovered that the placebo effect as a medic in World War II. Even now they used to use morphine to reduce the pain. When there is a lack of morphine, what he did is he replaced it with a simple saline solution, but continued telling the wounded soldiers it was morphine to calm them. To his surprise, almost half of the soldiers reported that the inert saline solution actually reduced or erased their pain. Beginning in the 1960s, the placebo effect became widely recognized and placebo control trials become the norm in the approval of new medications, and the contribution of Beecher led placebo to take an active role in the medical treatment. So let's start discussing about placebo, how we have to understand. We have to separate it from the health concept, or we have to integrate it with the health field, and we have to try to understand. Though the effect of placebos has seen light quite in the field of health, and rather than being taken out, they should be seen as a central to the health status of people. Thus, the importance of how these placebos work have to be understood thoroughly. There are several factors which mediate possible effects of placebos, and in order to understand these processes, several theories have been adopted. These theories can be broadly categorized as non-interactive theories and interactive theories. So first let's start discussing about non-interacting theories. As a whole, what these theories are trying to say. So they broadly concentrate on three areas. One is characteristics of the individual, the second one is characteristics of the treatment, and the third one is characteristics of the health professional. So let's come to the first point, that is characteristics of the individual. The susceptibility of the individuals to placebo effect has been clearly explained through individual theories in terms of emotional dependency, extroversion and neurosis. For example, if a person is more emotionally dependent, he may undergo the placebo effect more than the people who are less emotionally dependent. And next, the personality trait is about the extroversion. If they interact more with the practitioner, they may get convinced more and placebo effect may work more on them. Research has shown that individuals who respond to placebo are mostly introverts. So this is quite contrasting study which says introverts actually get influenced by the placebo effect than the extroverts. However, evidence against these characteristics towards the responsiveness to placebos was considered to be very little. So now, if apart from the characteristics of the individual, the next factor which we have to focus is on the characteristics of the treatment. Thus, other researchers have focused upon the treatment characteristics which can define the ineffectiveness or degree of the placebo effect. For instance, the higher the level of seriousness of the individual during the treatment, the greater would be the placebo effect. Likewise, a surgery is considered to have greatest placebo effect as it is perceived as seriously by the patient. As such, the size of the pills also matters as indicated by researchers whereby large pills are more effective than small ones, hence eliciting more change in the process. What this mean is, if a treatment is complex and if seriousness is more and treatment is more complex, obviously that arouse more fear and they may undergo more a placebo effect. So the third one is characteristics of health professional. It's not only the characteristics of the treatment or the characteristics of an individual, it is also the characteristics of health professional which plays key role in placebo. Research have shown that the characteristic of the health professional in terms of his level of professionalism and concern towards the patient can determine the effectiveness and the degree of placebo effect. In fact, the higher the status of the health professional, the greater will be the placebo effect. Now, just go back and just remember when you went last time to the doctor, or any of the example when you went to the doctor. What are the things, how do you attribute, how you connect yourself with your doctor? When you think that you underwent placebo effect, try to connect with these three concepts so that you can understand this concept in a better way. Okay, so now the next theory, which are combinedly as a whole known as interactive theories. This interactive theory is focused on the factors like experimenter bias, endorphin release, patient's expectations, reporting error, conditioning effect, anxiety reduction. Experimenter bias. Let's take this example in an laboratory setting. Experimenter bias refers to the impact that the experimenter's expectations can have on the outcome of the study. For example, if an experimenter was carrying out a study to examine the effect of seeing an aggressive film on the child's aggressive behavior, then the experimenter's expectation may themselves be responsible for changing the child's behavior by their own interaction with the child, not the film. Some example with related to health. For example, if an experimenter wants to study the effectiveness of being less stressful with related to walking, the patient may be less stressful because he knows that the experimenter is trying to see how the walking influencing his stress, but here maybe actually walking has got nothing to do with his stress. Okay, so the next factor is endorphin release. This is what I was talking about at the starting of the class, that biological reason for a person to undergo placebo effect is endorphin release. Endorphins are also known as feel-good hormones. As such, during a treatment, the brain has its own functioning of releasing pain-fighting chemical called endorphins, which helps in bringing out pain relievers at work in a placebo effect. Studied basing on neuroimaging evidence have shown that the endorphin system activates in pain-related areas of the brain, and that activity increases when people are told that they are receiving a medicine to ease their pain. So here you can see, it's not like through behavior. When you change your behavior and when you change your thinking pattern, that is affecting your biological process, and actually you're undergoing a placebo effect. So it got a good enough logic. Now the third factor which influence is the patient's expectations. The patient expectations during treatment can as well influence the placebo effect in terms of his involvement during the process and his willingness to get better after the treatment. Basically, placebo will work in accordance to the patients and the health professionals who expect the process to work, in the sense that is the interaction between the individuals and the environment determines the effectiveness of placebo effect. In the sense, if patient is not expecting, he is very negative and he is very pessimistic about the treatment, or he is not motivated enough to undergo treatment. He may think, oh, my fate is like that, this treatment would not work at all, then the placebo effect would be less. And if the doctor is not ensuring the patient, he is not telling the patient, okay, your health problems will get down, he is not ensuring much, or he is not, the patient, if he is not able to develop enough trust in the doctor, then also the placebo effect would be less, because that is indirectly affecting the patient's expectations. Sometimes if there is no proper environment around, in the sense if there is no proper social support offered to the patient, that also influence negatively the patient expectations, obviously then it results in negative placebo effects. In the sense, the chances of placebo effect to take would be very minimal. So now the next factor is reporting error. This we see most oftenly in the experimental conditions. Often the placebo effects are influenced due to some form of error or misreporting, which can be either on part of the observer or on that of the patient. It can be either way. Sometimes the problem may be from the experimental observer end, or that can be sometimes from the patient end. For instance, if the therapist wishes to see the effects of therapy, he tends to be biased in recording and perceiving the symptoms. On the other hand, on part of the patient end, if he or she wants to please the doctor, they might as well produce altered symptoms, resulting in some kind of error, which somewhat gave rise to double blind trials, whereby, in the sense, neither the experimenter nor the subject would be aware of the placebo effect. Not only in this reporting error, but most of the times placebo effect just takes place like that, but we are not aware of it. So the next one is conditioning effect. You may be familiar with conditioning. Conditioning works on the principle of association. For example, think about a child who used to go to doctor suffering from fever, and doctor prescribed some medicine, but it was not working. When he went again the second time with his parents, then doctor changed the prescription and gave, but it was not working. He was suffering. When third, fourth time, when doctor decided to give him an injection. If think the same thing continued twice, thrice in that child's life, and he grown as an adult, now he strongly, what he did is he associated with, okay, I'll get relieved if I take an injection. So here conditioning principle works with the placebo. Person, when he grows into an adult, the child who had a previous experience where he could overcome his health conflicts with taking an injection, he strongly starts believing, oh, if I take injection, then only my health problems, I can overcome my health problems. So then if he strongly believes that, even though if he don't have any problems and just he needs vitamin tablets or small medication, he still insists for injection, because he strongly conditioned that if I get injection, my fever will get down. So this conditioning process started working biologically. So if you put just a normal glucose or insulin water and inject him, that can work for him as an placebo effect, because here the conditioning principle is there. So next comes anxiety reduction. When there is a placebo effect, so placebos have also explained in terms of anxiety reduction, which accompanies the knowledge of having received treatment. Person is having a panic attack, or he got some problem which is mostly biological related than the physiological reasons. Then the placebo, if someone says, okay, you take this vitamin tablet, okay, I am treating you, that itself help them to reduce their anxiety, and this reduction of anxiety is itself help them to overcome the health consequences. So it means half of the problems are directly or indirectly relied on psychological consequences. The another important concept with regard to placebo effect is nocebo effect. where sometimes the patients may experience more pain when we try to use placebo effect. In the sense, the client, maybe because of anxiety, they may feel more anxious and symptoms may get more worse. So while administrating placebo effect or while trying to practice placebo effect, researchers have to be careful about this situation where patient may undergo more severe symptoms. And another thing which is very curious or important about the placebo effect is sometimes superstitious behaviors patients do develop in the process of treatment, that they believe in spite of having treatment I have to perform some rituals, then only I can overcome this health problem. That is also a part of placebo effect. Some of the patients develop more superstitious behaviors. Now, before concluding this lesson, let's have a quick summary about what we discussed. So let's start with a definition of placebo. Placebo, in the sense, it's an inert procedure where actually there is no any medical treatment, but yet the patient feel a kind of relief. And then comes to the history of placebo. We discussed about what kind of treatments which olden days people used to use don't have any logic and yet they are very dangerous. They have been proved very effective and most of the patients used to get relieved. Here itself, to what else we can attribute the reason? Of course, it's placebo effect. And then there are theories which we can broadly categorize as non-interactive theories and interactive theories. Under non-interactive theories, we focused on three factors. One is the characteristics of the individual, the second one is the characteristics of treatment, and the third one is the characteristics of the health professional. So, if the individual is very compiled, he is very emotionally dependent on the treatment, the placebo effect would be more effective. Also, the personality traits do affect the placebo effect. The studies are saying that if a patient is introvert, then definitely the placebo effect would be high on him. So next, coming to the second one, the characteristics of the treatment. If the treatment is very complex and depending on the prescription and kinds of pills doctor prescribed to the patient, that also affects the placebo effect. And next comes the characteristics of health professional. If the health professional is seen as very senior and very competent, then the placebo effect would be higher than if a doctor is very young and he just started his practice recently. And next, a category of theories we call as interactive theories. And the first factor is experimenter bias. So experimenter bias indicates the impact of experimenter expectations. Sometimes the expectations itself work as a placebo effect. And next comes the endorphin release, which is very crucial and important because it involves the biological process. And this automatically releases endorphin hormones, which are also known as feel-good hormones, which help in reducing the pain. And next comes the patient's expectations. If the patient expectations are high, then obviously the placebo effect would be high. And next comes the reporting error. It can be sometimes from the experimenter end or sometimes from the patient end. This blind effect may also influence and the placebo effect. And next comes the conditioning effect, which works on the association, where we get conditioned to certain things and we strongly believe that if we undergo only that particular treatment or that particular situation, then only our health problems will get off. And next comes the anxiety reduction. So when there is a kind of treatment we are undergoing, that itself, the awareness that we are undergoing treatment, that knowledge itself will help to reduce the anxiety, and that also works as placebo effect. So I hope this whole concept of placebo you are clear with now, and the further material provided for you will help you to understand the placebo concept in detail with the case studies and several links which are associated with. You can use them as a references to understand the concept of placebo effect in detail. Thank you.